Have you ever been in a class and realized that you had no understanding of the information being presented or had difficulty grasping the content that was being shared? Have you struggled even after reviewing your notes, seeking other resources, and asking a classmate for help? This does not indicate a learning disability, but it can give you a little insight into what it is like to have a learning disability and how students with learning disabilities may struggle. Many children have problems with learning and behavior from time to time, and differences in development are pretty normal. However, a consistent unevenness while learning new skills and behaviors may indicate an underlying learning disability. Historically, the concept of learning disabilities has been associated with disorders in cognition and learning existing within an individual, resulting in delays in academic and school performance skills such as reading, math, and language. Compared to other disability areas, the field of learning disabilities has had a brief and relatively intense progression. Over the years, it is the contributions from medical professionals, psychologists, educators, and parents that have helped define and come to the current understanding of the disorder. Development of the learning disability field can be best described and understood through 4 phases. The first phase, or the foundational phase, encompasses the years from 1800 to 1930. Early conceptions of LD took place during this time period and included understanding the relationship between specific brain injuries and loss of functioning such as language or perceptual skills. The transition phase, which spanned the years from the 1930s to 1960s, gave way to labels such as brain injury and minimal brain dysfunction. This phase was popularized by brain-based research on children and findings that children with learning difficulties had similar characteristics to adults with brain injuries. The integration phase encompassed the years from 1960 to 1974. The term learning disability was officially coined by Dr. Samuel Kirk during this time. This period really began to emphasize the impact of learning problems on academic progress and emphasize the perceptual nature of the disability. In 1963, Dr. Samuel Kirk delivered a speech where he discussed how labels, such as brain injured and perceptually handicapped, were satisfying to some, but were not useful in helping students. In this speech, he went on to say that labels were merely classification terms that did little to assist treatment and remediation. While the term learning disabilities was used during this presentation, it had already been used in a special education textbook that he published in 1962. Thus, Samuel Kirk coined the term learning disability. The federal definition of learning disability includes that it is a disorder in one or more of the basic psychological processes involved in understanding or in using language, spoken or written, which may manifest itself in an imperfect ability to listen, speak, read, write, spell, or to do mathematical calculations. The term also includes such conditions as perceptual handicaps, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. The term does not include children who have learning disabilities, which are primarily the result of visual, hearing, or motor handicaps, or intellectual disability or emotional disturbance, or of environmental, cultural, or economic disadvantage. You may have heard the term dyslexia, dyscalculia, and dysgraphia. These terms are ones that were originally coined to describe difficulties mastering academic concepts that stem from a learning disability. Unfortunately, people tend to think that they are not descriptions of difficulties, but rather explanations for difficulties. The Latin word dys means difficulty. The Latin word lexia refers to reading, so dyslexia means difficulty reading. Graphia is Latin for writing, and calculia is a Latin word referring to math. Thus, a child experiencing great difficulty learning how to write or learning math can be said to have dysgraphia and dyscalculia respectively. Dyslexia, dyscalculia, and dysgraphia are just terms used to describe children who have difficulty learning to read, do math, and write. They don't provide any special insight as to why they are having problems learning. I'm sure, just as this comic shows, each one of us can find some of these characteristics in ourselves. It is important to remember that there is no known cause of learning disability. However, people are in total agreement that learning disability is a biologically or organically based condition. Individuals with learning disability have brains that work differently than people without learning disabilities. Their brain processes information ineffectively, and this causes the problems in achievement. Take a look at this picture depicting differences between a normal brain and a brain of an individual with dyslexia. As with intellectual disability, we know that LD can be caused by prenatal, perinatal, and postnatal factors. Prenatal causes of learning disabilities may include smoking, substance abuse, and alcohol use. Perinatal factors may include prolonged and difficult delivery, anoxia or oxygen deprivation, prematurity or low birth weight, and trauma from medical instruments. Postnatal causes of LD may include stroke, concussion, meningitis or encephalitis, high fever, and head injury resulting from falls or accidents. Many of these factors may sound familiar from previous modules. That is because any number of these factors could cause a range of disabilities. On the flip side, they may not result in a disability. To reiterate, a number of factors have been found to be related to LD, but there is no known cause. Today, there are far more students with learning disability than any other disability served under IDEA. Approximately 45% of the children with IEPs in the United States are served under the IDEA category of learning disability. That is about 4 out of every 100 kids. Learning disability is disproportionately represented from boys to girls. 4 boys to every 1 girl are identified with a learning disability. Learning disability is very rarely identified in early childhood. It would be a very unusual case for a child to get a diagnosis of a learning disability before the age of 6. The kids who get identified with a learning disability are typically in the 2nd, 3rd, 4th, or 5th grades when academic demands are more heavily placed upon the child. Take a second to think about this question. What factors affect the prevalence of learning disability? Did you think about gender, ethnic background, or geographic region? If so, you were correct. Factors such as gender, ethnic background, and geographic region can affect the prevalence of learning disability. As we discussed in the previous slide, there are 3 to 4 times more boys diagnosed with a learning disability than girls. Some states have also shown over or even underrepresentation of African American children diagnosed with LD. The prevalence rate can also vary by state. However, this may be due to criteria used for identification within each state. When learning disabilities was originally described, it was perceived to be a rather unusual and rare disability. The classic definition of a learning disability refers to a discrepancy between a child's potential and a child's level of achievement. Originally, they were talking about very bright children whose IQ scores were in the average range, or even above average range, but they had very low academic achievement. This classic case of learning disability is actually rather uncommon. LD is still technically considered a disability where there is a discrepancy between ability and achievement, but in reality, it is signified by low achievement in academic areas. The federal law, IDEA, notes that there no longer has to be a discrepancy between ability and academic achievement in order to be eligible for special education services. Documentation that the child has failed to respond to intervention can be used and therefore can constitute a diagnosis of a learning disability. This is the graphic that represents the RTI model. We looked at this model during an earlier lesson. Tier 1 is a series of universal interventions, also called primary interventions. These interventions are provided to all students, and it's believed that 80% of the students will be able to make adequate yearly progress with the primary interventions. Tier 2 is the targeted interventions. If a child fails to respond to primary interventions, then the child receives targeted or secondary interventions. Tier 2 interventions provide more intense instruction and are intended to catch a child up with grade level expectations. If a child does not respond to the Tier 2 interventions, despite getting good interventions, the Tier 3 interventions would be considered. Tier 3 consists of the most intensive interventions. If a child continues to have difficulty making progress, and they do not respond to more intense levels of interventions with greater rates of learning, this can lead to a diagnosis of LD based on a failure to respond to interventions. According to federal law today, a school district can use RTI data as the sole reason to make a diagnosis for a child with a learning disability. Whether an LD diagnosis is made through determining the child has a discrepancy between ability and academic achievement, or through documentation that the child has failed to respond to increasingly intensive instructional interventions, difficulty in academic areas is at the heart of learning disability. Certainly, lack of progress in academic areas can be a sign of other disabilities as well, but one would not get diagnosed with a learning disability unless a student was having some academic achievement problems. The most common type of academic difficulty is reading. 80% of children with learning disabilities have primary deficits in the area of reading and language functions. With the right interventions, adaptations, and accommodations, they can benefit from instruction in the general education setting and can be successful at grade level in their schools.